Hello, everyone. This week we will be doing a training on prevention of sudden infant death syndrome, also known as SIDS, and then safe sleeping practices or habits. My name again is Annaleah Hilker, and I'm the onboarding and training manager as well. So as we jump into this, we are taking a break from the abuse trainings that we've been doing. This one's not all that much more of a fun topic, but still is need to know information, and it's good for us as we are in a unique position where we get to take care of these kids. So for starters, what is sudden infant death syndrome? Sudden death of an infant under 1 year of age, which remains unexplained even after investigation, autopsy, examination of the death scene, and review of the clinical history. So typically, there's 3 different categories that infant death falls into. There's sudden unexpected death, and then sudden infant death syndrome. Your unexpected goes more into the, there really is no cause for it. They can't tell whether it was just the history or the place that the child was at. But the sudden infant death syndrome typically goes unexplained after investigation, autopsy, anything that they can do to really determine what could have caused this. So again, this is kind of a hard topic. It's not necessarily a fun or easy one. So I want to hear from you guys. Why do you think we talk about sudden infant death syndrome and the practice of safe sleeping habits?
So from my understanding, the reason we do that is because safe sleeping habits helps to possibly prevent sudden infant death syndrome, and namely sleeping on the back being key and making sure the babies are not sleeping on their stomachs. That's a big factor in the reduction rate of the likelihood of that happening.
Yeah, exactly. One of the biggest reasons that we talk about this is if we know the safe sleeping practices, we are able to prevent and bring down the numbers of these sudden infant death cases. Any other thoughts about why we would talk about it?
We're in a unique position as people putting infants to sleep a lot, that if we don't have this knowledge, that we could get into some very difficult situations. And that's really something we don't need to encounter if we can educate ourselves about it.
Yes, exactly. I'm a firm believer in the statement, knowledge is power. So if we are informed about how to actually practice safe sleeping habits for these infants, we get to put them in use as well. Knowledge is hard to implement when you don't have it. So I like that. Again, just that knowledge is power. And we are in a unique position. Moving forward, so talking a little bit about the numbers, this also can go to explain why it's important to talk about. There's around 3,400 sudden unexpected infant deaths per year. Of those unexpected deaths, well, in 2019, there was the exact amount was 3,376. Of those, there was 34% unknown causes. They couldn't determine if it was, if it could count as this SIDS or if it would count as something else. So they put it in this third unknown cause. 28.3% was from accidental suffocation and strangulation in bed. And then 37% was from the sudden infant death syndrome. These unknown causes typically we aren't able to prevent those. So this number sadly varies just dependent on the year, but these two, the blue and the green, these are both numbers that, having this knowledge and talking about possible causes, we're able to help bring those numbers down. So going into, so again, just these are things that we can do. There are things that we can do to help prevent and lower the number of SIDS. So there are what they call other sleep-related deaths in there. That green section was strangulation in bed. There's 3 different main things that go underneath this. These are related typically to how or where a baby is sleeping. And again, these 3 include suffocation, which is when something such as a pillow or something covers the baby's face and nose, blocking their ability to breathe. That entrapment, which is when a baby gets trapped between 2 objects, typically a mattress and the wall, or their mattress and something else, which again blocks their ability to breathe. And then the last one is strangulation, which is when something presses on or wraps around the baby's neck, again blocking their ability to breathe. All of these things can be prevented. And so it's our job to make sure that we are doing that. What are some ways, just based off of the definitions, what are some safe sleeping practices that we can do to help prevent these sudden infant deaths?
To not use bumpers in a crib, for one.
Yep, that's a big one. That's actually one that I hadn't been super aware about, but going through this training, it was one of the big things that they actually brought up.
Are you supposed to put babies on their back when they sleep? Because this lady that I nanny for, she puts her baby on his stomach, and like I thought that was kind of weird, but she has 5 kids and she's done that for all of her kids. But are you supposed to put them on their back?
And this is actually something that we will talk about in this as well, but under the age of 1, you are supposed to put them on their back. If they have the ability to roll and they roll onto their stomach, it is deemed at that point that if they were to have issues, that they would most likely roll back onto their back as well. But if they are unable to roll, the safest place for them to sleep is on their back. There are different medical conditions, and so sometimes your baby's doctor will tell you otherwise, but in general, the safest way for a baby to sleep is on their back. Other questions or thoughts on how to prevent SIDS? That's the word.
Removing all of like toys or fluffy blankets.
Yeah, that is definitely another one. So some of these are going to be repeats because you guys hit these right on the nose. So the first one that we'll talk about is never placing an infant to sleep on soft surfaces such as a couch, sofa, waterbed, a pillow, quilt, sheepskin, or blanket. What these do is they can cause the baby's body to kind of fold in on itself, which can block their airway and they can suffocate, even though nothing really is strangling them or anything else. Like just that fact that their body could be in a different position can cause them to not be able to breathe. Some will say that it's actually not even all that safe to put a baby on your normal typical adult bed because it can be considered just as soft. And your typical crib mattresses are a lot firmer. So in these daycares, best place to put a child, an infant when they are asleep is in their crib. A car seat, stroller, swing, or similar product is not considered safe sleep equipment. Typically, if they fall asleep in these places, that's okay. They're not going to suffocate from just a few minutes as they're falling asleep. But if a parent brings in a child that fell asleep in the car and they're still in their car seat, we need to be moving them from that car seat to their crib for that longer amount of sleep time. Same thing, a lot of daycares will have swings or bouncers. If the child falls asleep in those play equipment, that is fine, but we need to be making sure that we move them for a longer amount of sleep period. Crib bumpers, this one was already mentioned. So crib bumpers are linked to serious injuries and deaths from suffocation, entrapment, and strangulation. So this one hits all three. The crib bumpers, if a child was to be too close to the side and was to turn their head into that crib bumper, they could suffocate from blocking their nose and mouth. It also can lead to entrapment of if that was to rise up a little bit too far, they could get stuck in between it and again, cause themselves to suffocate. And then if it was to happen to fall off, it could wrap around them, again, causing them to not be able to breathe. Places will market their crib bumpers as breathable, but even those ones are just as dangerous as these other crib bumpers that you can see here. I have never seen a crib bumper in a daycare. It is not something that is allowed by childcare licensing laws. So luckily you don't have to worry about that in these daycares. But again, the information, knowing what is and what isn't good out there, it's just good information to have. Other ways to help prevent, this one was also mentioned, not putting soft objects such as toys, stuffed animals, pillows, or loose blankets in the sleep area. It is against childcare licensing laws to have a blanket in a crib with a baby that is under 1 year of age. It is also not allowed. A lot of them have binkies that have either it's connected, it's a little strip of cloth that connects the binky, and then it's got like a little clip on the other side that you can clip to their clothing. Some of them have little like shapes on them, different things like that. Those are also not allowed in their cribs. Those can be a strangulation hazard. Binkies are allowed, but not the attachments that come on them. Even the stuffed animal ones that like some binkies will come with those stuffed animals. They can have them during the rest of awake and daycare time, but as soon as they're asleep, you need to either be switching out the binky or taking off those attachments. Those are the big ones I see. Most daycares don't have stuffed animals that they put in the cribs unless they're storing them at the end of the day. But all of these things, if we're keeping them out of the cribs, it goes a long way in helping to prevent SIDS. This one talking a little bit more, offering a pacifier to an infant can actually help prevent SIDS. This one, I don't know the science behind. I couldn't really find anything as to why, but they did say that pacifiers reduce the risk of SIDS for all infants, including those that are breastfed. They do mention that if your child is breastfeeding, typically waiting to introduce the binky until they're pretty solidified on how to nurse from the breast first is good before introducing that pacifier, just so they get used to having both. But for some reason, having a passy actually does reduce the risk. If anybody knows and wants to inform me of why, like what the science is behind that, I would actually love to know. But I couldn't necessarily find anything. They did also mention though that if the pacifier does fall out during sleep, you don't need to put it back in. And because it's the passy, it won't, you don't need to take it out of the crib either. They're okay with the pacifier being in there. But some kids, if you try forcing the pacifier back in while they're asleep, it'll wake them up. So they did say that it was okay if it did fall out. And then the last few ways that we'll talk about to help prevent SIDS. This is a big one. This one we kind of talked a little bit about already, but placing an infant on their back actually reduces the risk by a lot. If you place them on their stomach, it increases the risk of sudden infant death by 13 times. So again, there will be some cases in which they have a doctor's note or something that says that they are allowed to sleep on their stomach. And again, if they are at the age where they are able to roll, it is okay to allow them to roll, but every time we lay an infant down to sleep, it has to be on their back. This is a big number, 13 times, that simply the position of how they're sleeping, we can reduce that so easy and so quick. So just something that we really need to be aware of and making sure that we're doing. Another one that seems common sense, but isn't to a lot of people, having only one infant asleep in each piece of sleeping equipment. This one you come across more so when there's twins in a daycare. They think because they're siblings, like, it's okay, just place them in the same pack and play or whatever. And while they're awake, that's totally fine. If they're awake and they're playing, they can be in the same play equipment. But when it comes to sleep time, each infant needs to have their own place to sleep. Another big one that I didn't really necessarily know, but making sure the room temperature is comfortable and that infants are not overdressed. Overheating can cause sudden infant death syndrome as well. Some signs that a child is overheating include if they're sweating or they're clammy to the touch, and then if their chest feels hot. That can be a really big indication of overheating. There's two different things that you can do. If they are in a sleep sack or something that seems a little bit heavy, you can go ahead and start taking off layers, but also turning down the temperature in the classroom is a good idea, or putting a fan on, any of those things to help lower the temperature so they're not overheating as they sleep. And then the last one, ensure that infants are not exposed to smoke. Their lungs are tiny and fragile, they're still developing. So having that exposure can weaken their lungs, which causes them to have a harder time to breathe. Any question, comments, concerns, anything to add about this treatment?
Is there an ideal temperature?
That is a great question. I do know that they actually listed that. So let me look that up again really fast from my notes. Or actually, yeah. Give me just 2 seconds. I know they had it in a different training that I did. where we actually talked about infant classrooms and their sleep schedule. So this one is saying the best temperature is between 68 to 72 degrees Fahrenheit. Or if you're more Celsius, that's 20 to 22 degrees. They're more sensitive to changes as well. So if it goes really cold, that can be harmful as well. So making sure, honestly, the best way to do it would probably be to just turn on a fan, not directly on them, but in the room. That can help bring the temperature down, but that in between 68 to 72 degrees.
Can I ask one other quick question? Sorry. In your chart, you had the 3 different categories for the deaths. One was the unknown, and then the other one was the sudden infant death syndrome.
Mm-hmm.
What's the difference between the two? I just assumed the unknown was constituted being sudden infant death syndrome. So what's the difference between those two?
So typically, the biggest difference that I could come up with is sudden infant death syndrome normally has more to do with your, it could have been prevented. So if you were placing them on a couch and they passed away because they couldn't breathe because they were on a couch, that typically goes towards sudden infant death syndrome, where unknown is they were totally healthy, they were totally fine, there was no cause of strangulation or suffocation. It couldn't have been prevented at all. They just suddenly passed. It also didn't come from clinical history, like they didn't have some unknown heart condition that caused them to pass. So just from what I was researching up and what I understand, the sudden infant death syndrome you typically could have prevented if you had known about it, but the totally unknown is just, there was no explanation. It just happened.
Okay, thank you. I appreciate that.
Yeah. Other questions or comments?